Hello, my people. This is Mwanguzi Shadrack, your doctor from Health Touch Uganda. As part of our Reproductive Health Awareness Month, today we are going to be talking about sexually transmitted infections. When we talk about sexually transmitted infections, we mean those microorganisms that one is likely to get or to acquire from the partner who is already infected during a sexual act. More than 30 different bacteria, viruses, and parasites are known to be transmitted through sexual contact. 8 of these pathogens or microorganisms are linked to the greatest incidence of sexually transmitted diseases. Of these, 4 are currently curable, and that is syphilis, gonorrhoea, chlamydia, and trichomoniasis. The other 4 are viral infections, which are incurable, that is hepatitis B, herpes simplex virus, also called HSV or just herpes, and then we have HIV, and finally human papillomavirus, also called HPV. Sexually transmitted infections are spread predominantly by sexual contact, including vaginal, anal, or oral sex. And some STIs can also be transmitted from mother to child during pregnancy, childbirth, and breastfeeding. A person can have an STI without showing symptoms of the disease. And the common symptoms of sexually transmitted infections include vaginal discharge, urethral discharge or burning in men, genital ulcers, and abdominal pain. So basically those are the things we are going to be talking about. One would wonder, okay, why sexually transmitted infections today? I want to say STIs have a profound impact on sexual and reproductive health worldwide. More than 1 million sexually transmitted infections are acquired every day. And when you look at the year 2020, the World Health Organization estimated 374 million new infections with one of the 4 STIs, that is chlamydia, gonorrhea, syphilis, and trichomoniasis. More than 490 million people were estimated to be living with genital herpes simplex virus infection in 2016, and an estimated 300 million women have an HPV infection, the primary cause of cervical cancer, by the way. An estimated 296 million people are living with chronic hepatitis B globally. Chronic means they have it for a long time, because it can be acute, which they get really and clears, or it can go into the chronic state where people go ahead to live with it for quite a long time. Remember, both HPV or human papillomavirus and hepatitis B infections are preventable with vaccination. Sexually transmitted infections have serious consequences beyond the immediate impact of the infection itself. For example, these STIs like herpes, gonorrhea, and syphilis can increase the risk of HIV acquisition, because remember, during a sexual act there are going to be fluids released from either the vagina or the penis, and when you have ulcers or wounds or open skin in your vagina or on your penis, it's going to be easy for those sexual fluids to get in contact with the deeper parts of your skin, which increases your chances of acquiring HIV. That's why we say when you have herpes, gonorrhea, or syphilis, your chance of acquiring, or your risk of acquiring HIV is also increased. Then, the mother-to-child transmission of STIs can result in stillbirth. Stillbirth means a child is born dead. Neonatal deaths, these are babies who die within those first hours or first 28 days of delivery. Then low birth weight, prematurity. Prematurity means the baby is born before term, before completing 37 weeks of pregnancy. Then sepsis means the blood gets infected with germs, pneumonia, other problems with the lungs. Neonatal conjunctivitis, where the eyes of the baby, the newborn babies, get affected. Congenital deformities means a child or a baby is born with abnormalities. And approximately 1 million pregnant women were estimated to have active syphilis in the year 2016, that resulted in over 350,000 adverse birth outcomes, of which 200,000 occurred as stillbirth or neonatal death. So either babies were born dead or they died right after birth. So that's quite devastating. And HPV, or human papillomavirus infection, causes cervical cancer. And cervical cancer, remember, is the leading, is the fourth most common cancer among women globally, with an estimated 570,000 new infections in 2018 and over 311,000 cervical cancer deaths each year. That's worldwide. But when you come down here on ground in our settings like Uganda, you really find cervical cancer being a leading cause of cancer-related deaths among women. Hepatitis B resulted in an estimated 820,000 deaths in 2019, mostly from what we call liver cirrhosis and hepatocellular carcinoma. That's kind of primary cancer in the liver. Sexually transmitted infections such as gonorrhea and chlamydia are major causes of pelvic inflammatory disease. Pelvic inflammatory disease is because we are looking at the organs found within the pelvis of a woman, the uterus, the fallopian tubes, the ovaries, and the surrounding structures around there. They might be infected by microorganisms. So these STIs, gonorrhea and chlamydia, are the major causes of those pelvic inflammatory diseases and infertility in women. So that's why it's actually very important for us to discuss such a topic, because we are seeing it actually causes a lot of, STIs cause a lot of issues. I've told you they increase your chances of acquiring HIV, increase chances of, in cases of mother to child transmission, you can have issues with the pregnancy or the baby. Cervical cancer from HPV, hepatitis B really causing a lot of issues, including cancer of the liver, then infertilities in women, and many other issues. So those are sexually transmitted infections. One would wonder, how can I prevent sexually transmitted infections, also called STIs? When used correctly and consistently, I want to say, condoms offer one of the most effective methods of protection against sexually transmitted infections, including HIV, by the way. But like I emphasized from the very beginning, that when used correctly and consistently, they are really very good. Condoms also protect against unwanted pregnancy in people who have agreed to use them in mutually consented sexual relationships. Although highly effective, these condoms do not offer protection for STIs that cause extragenital ulcers. There are some sexually transmitted infections like syphilis, genital herpes, which make you have wounds, or what we call ulcers, on other parts of the body other than the genital or the penis and the vagina. For example, you can have wounds on the thighs or even on any other part of the body. So that means the condoms will not give you protection against such infections. So when it's possible, condoms should actually be used in all vaginal and anal sex. For those who practice oral sex, I don't know how practical it is, but the advice would be condoms should be used in all forms of sex. That is condoms. The other way, we have safe and effective vaccines which are available for 2 viral STIs, that is hepatitis B and HPV, or human papillomavirus, the one we said causes cervical cancer. These vaccines have represented major advances in STI prevention. By the end of the year 2020, the HPV vaccine was introduced as part of routine immunization programs in over 111 countries, most of them high and middle income countries, ours inclusive, of course. HPV vaccination could prevent the deaths of millions of women over the next decade, by the way, in low and middle income countries, where most of the cases of cervical cancer occur. If more than 80% of the people are vaccinated, especially now we are vaccinating girls between the ages of 11 and 15. So if we could achieve more than 80% vaccination of these girls between 11 and 15 years, we could almost prevent 1 million deaths of women in the next 10 years from now. There is research ongoing to develop vaccines against HIV and herpes, and many of the candidate vaccines are in clinical trials, and we continue to pray that these clinical trials yield really good results so we can have effective vaccination against HIV and HPV. Remember, I mentioned 4 viral infections which are incurable: HIV, herpes, HSV, and hepatitis B. But I told you that hepatitis B and HPV have an effective vaccine, or have vaccines. Now, if we can get the vaccines for HIV and herpes, or HSV, herpes simplex virus, then it means we are actually getting on top of these sexually transmitted infections. More research into vaccines for these others like chlamydia, gonorrhea, syphilis, and trichomoniasis are also needed and underway, but the beauty about them, at least for them, they are curable. We have the drugs you can use to cure them. Only that, if the vaccine was in place, it would even be better. So we also have other ways of controlling or preventing sexually transmitted infections, and these include adult male circumcision. When a man is circumcised, their risk of acquiring sexually transmitted infections actually go low, and use of micro. So once you are confirmed to have a sexually transmitted infections, of course, when you get those symptoms like low abdominal pain, abnormal vaginal discharge, or penis discharge, or ulcers around the private parts, itching on urination, and all that, you come to hospital. We take that history, we do the necessary examination, we do the necessary investigations, and we confirm that you have a sexually transmitted infection. We shall start you on treatment. The treatment is available for several sexually transmitted infections. So these 3 bacterial STIs, chlamydia, gonorrhea, and syphilis, and 1 parasitic STI, trichomoniasis, are generally curable with the existing single-dose regimens of antibiotics. But like I told you, herpes and HIV, the most effective medications available are antivirals that can modulate the course of the disease, that they cannot cure the illness. So when you get HIV, when you get HPV or herpes, HSV, or simply called herpes, we just give you antiviral treatment to ensure the illness does not cause a lot of severe symptoms, effects, and also causing premature death. For hepatitis B, antiviral medications can also help to prevent the virus and slow the damage to the liver. We have a challenge. There is what we call antimicrobial resistance of STIs. When we say antimicrobial resistance, we mean microorganisms, for example, the bacteria, the viruses, might become resistant so to the available medicines that you administer a certain drug to someone that has this particular infection, but because the infection is already resistant, the drug doesn't clear or doesn't kill this infection. So it's a problem that we are getting, especially for gonorrhea, and it has increased rapidly in the recent years, which has also caused a lot of fears and worries. There are many programs to monitor that, and also many research projects to ensure this problem is mitigated. But currently we have a lot of resistance to gonorrhea infections. But generally speaking, I want to say, just in case you get those symptoms, it's better you go to a health facility and they give you the medication. They'll advise you on how to take this medication, how long you should take it, and also advise you to take the same treatment with your sexual partner stroke partners. When you're giving details about your partner stroke partners, make it clear if the lady is pregnant or not, because some of the medicines we use to treat sexually transmitted infections may not be safe in ladies who are pregnant. So basically, those are sexually transmitted infections. I've told you how we get them, the severe damages or the adverse effects that we are likely to get when you have these sexually transmitted infections, and what to do when you get them, and what to do in order to prevent them. I love you so much. This is Mwanguzi Shadrach, doctor from Health Touch Uganda. Like I keep telling you, you have one life to live. Oh yes, one life to live. Health Touch Uganda, follow the light.